this week's show, a crisis with no cure. Greece's crippling recession sees a once proud health system brought to its knees.
It's a bit full with medicine, you know. You can see there's no medicine, so we can't do our job correctly.
Hospital shortages, an explosion of AIDS and the return of forgotten diseases. Many Greeks are now calling for humanitarian aid.
This is a war. Crisis is a war. In the game now, there are human lives. It's the bet.
No jobs and no insurance. In Greece, 1/3 of the population has no access to free care.
Cancer is one disease and lack of money is another disease. It's a mayhem, it's a nightmare, and it's just beginning.
I swear by Apollo, the physician, and all the gods and goddesses.
Whatever houses I may visit, I will come for the benefit of the sick.
Remaining free of all intentional injustice and corruption.
I will keep them from harm and injustice.
He's known as the father of Western medicine, and pledging this man's famous oath is today still a rite of passage for new doctors. Hippocrates set the bar high for his profession, calling on principles that are difficult to uphold even when times are good. Today, Greece is suffering its 6th year of recession. Its health system is crumbling, and with it, the very ideals on which modern medicine is based.
Good morning, be strong. Everyone in Greece, be strong.
Meet Georgios Tragas, Greece's very own shock jock. Every morning his radio program rates among the highest in the country. His centre-right views are deliberately provocative, and slamming the Greek health system is one of his pet pastimes.
If you are sick and you're listening today here on Real FM, send us your stories.
Tragas's show may reflect popular opinion, but he's also going some way to shaping it. His fury is directed at the European Union, which he blames for the current state of affairs.
The waiting list for examination is getting longer and longer. There's a very, very long delay for people in need of an operation. The state of the health system in Greece is now a humanitarian crisis.
Life in Greece has been turned on its head since the debt crisis took hold. Today, 1 in 4 Greeks are jobless. 240 billion euros of bailout funds have come with a price. Severe austerity measures that have left Greek public services in tatters. In exchange for EU assistance, the government scrapped its system of universal healthcare. Access to treatment has never been so far out of reach. There is one way, however, to jump the long queues: corruption. None of the following patients will show their face, but each admits to a Greek tradition known as fakalaki, in other words, paying a bribe. 1,100 euros for an ear operation, 150 to remove a cyst, 300 for angioplasty.
1,500 euros for a surgery. 1,200 euros again for...
This website, which translates as I have given a little envelope.com, is bringing fakalaki into the open. Visitors are invited to post stories either of paying a bribe or indeed accepting one. In 4 months, the site's attracted nearly 1,500 testimonies, and with it, evidence of almost 5 million euros of corruption.
They only reveal the problem, something that we all knew, but some people didn't want to believe. Maybe the crisis and all this thing has made a lot of people think that we are the ones who are responsible about this and we should do something.
This is one place you can be sure your bribe is not welcome. Greece's oldest hospital is run by Theodoros Gennaros, a director who leaves no room for interpretation.
What's this message saying? Because that looks like a no smoking sign.
No, there's no smoking sign. There's no envelope. Fakelaki, as you said, this is not accepted here.
And what would you do if you found out a doctor? It's always a temptation.
In this hospital, his medical legs are going to get cut off.
Like all of Greece's public hospitals, this facility has had its budget cut 50% in 3 years. And for every 10 doctors that leave, only 1 is replaced, leaving the rest to plug the gaps. Only last week, they lost one of their young surgeons to burnout.
He was on duty for 3 o'clock in the afternoon till the day tomorrow, 8 o'clock. And then he was continuing to working until 3 o'clock in the afternoon. So you can say that it's 24 hours on duty. So it's quite impossible to do. The mistakes can happen much more easily. Happens even here, yes.
The staff here tell us they lack equipment and even basic materials such as tissues and gloves. This doctor in training is hesitant but finally agrees to show us the room where supplies are normally stored.
It's a bit full with medicine, you know. You can see there's no medicine. Things are not so good, but okay, we're trying.
So you do your best?
Yeah, we're doing our best with what we have. Here we should normally have like 6 or 7 crates with all the syringes. You see we have only 2, and this actually arrived right now. I think it's quite idiotic because we're talking about something that costs like 10 euros or 15 euros, and for 10 euros we're not doing our job correctly.
Here it's not unheard of to ask patients to bring medicine or supplies bought outside the hospital. Bramis Spiros is recovering from an operation. He tells us he'd help out if he could.
I would give them simple things like pillows, sheets, medicine, syringes, which they don't always have. Look at this here, this surgical tape. They have to cut it in half, from 5 centimeters to 2.5 centimeters to make it last.
Theodoros Gennaris likes to set his own rules. His hospital is one of very few in Athens to treat uninsured Greeks. Every month as many as 20 patients come here for urgent, life-threatening operations. It's not legal to provide this healthcare, but he's willing to take the risk.
My charges are going to be that I help people, I didn't let people die. So it's good with me. They can try it. This is a war. Crisis is a war. In the war, we don't have conventional rules. We are not going to allow anybody to make us lose human lives, period.
This former Greek army pilot takes us to a volunteer clinic where he finds patients most in need. Since it opened 1 year ago, this social practice has treated 16,000 patients, all of them without insurance or the means to pay for their care. Many have suffered from cancer, like Barbara Makera, who comes here for treatment.
I have no money. For the first time of my life, I'm poor, and I have to admit it. My drugs are not expensive. For me, they are, but it's 12 euros per month.
Medication is hard to come by in Greece at the moment, with or without money. Many chemist shelves are empty, even here in the capital. Certain antibiotics haven't been seen for more than 3 months.
Personally, I feel really bad. There are people who come in here and then live with nothing. We have to tell them to go somewhere else to find their medication, and no doubt their life is in danger.
The problem is multifaceted. The state has no money to reimburse pharmacies, provoking a chain effect. Others accuse wholesalers of selling drugs overseas where prices and hence profits are higher. And now certain pharmaceutical companies are refusing to deliver medication without payment. One rebel MP has made it his mission to make those responsible pay. In December, Panagiotis Kouroumplis, a member of the main opposition party, challenged the health minister to open an inquiry into the shortage.
We've seen first-hand evidence of medicine shortages here in Greece. Who's responsible?
There's a very serious problem, and it comes from the unacceptable attitude of pharmaceutical companies. For many years in Greece, they have earned between 4 and 5 billion euros annually from the consumption of medicine. Now that the country is in a difficult position, they refuse to abide by Greek legislation. When people can't find the medicine they require, you can understand. This causes huge insecurity.
που έχει ανάγκη τη δεδομένη στιγμή, αντιλαμβάνεστε κανείς ότι υπάρχει.
Five years ago, this neighbourhood in the outskirts of Athens was considered middle class. Today, many of the homes around me have no water or electricity and, of course, no money for healthcare. This Centre of Medicine du Monde opened in 2009. It was specifically to treat immigrants. Today, 90% of its patients are Greek.
This morning, as always, there's a long queue inside this clinic. They've come to treat chronic conditions such as heart disease and diabetes, and more recently, problems brought on by economic stress. Doctors in Greece are also reporting the return of forgotten diseases, tuberculosis and even malaria. But it's here in the centre of Athens that we come across the most startling health statistic of our visit. Since the crisis began, there's been an explosion of HIV among drug addicts, up to 20-fold in less than 2 years, blamed largely on inadequate needle exchange.
This is a stuff we are giving to them.
These volunteers take us to see where the drug users loiter, only several hundred metres away from the main square. Among them, immigrants, the homeless and prostitutes.
They're coming from all sides of Athens, you know, here. All these people are using shisha. It's very popular because it's very cheap. It's a new drug, you know.
Shisha is made up of methamphetamines and liquid from car batteries. It appeared in Greece for the first time in 2010, making it the drug of the crisis, and its users the anonymous victims.